Hearing screening that's fast, simple, and portable. That's AuDX, the OAE hearing screening system from Biologic Systems Corp. The AuDX system works with all ages, from newborns to geriatrics, and is most useful as a hearing screening tool for peripheral hearing loss in individuals who cannot be tested using conventional behavioral audiometry. AuDX is widely used in universal newborn hearing screening programs, as well as school systems and pediatricians' offices, to identify potential hearing loss early, before significant language delays develop. It is also widely used by ENT physicians and audiologists as a routine component of a complete audiological test battery. The AuDX system streamlines the screening process. Tests are simple to perform, and the results are clear. Otoacoustic emissions are sounds produced by the outer hair cells of the cochlea in response to specific acoustic stimuli delivered into the ear. AuDX uses a probe containing a sensitive microphone placed in the patient's ear to record this response and compare it to the expected response from a normally hearing ear. Based on this analysis, AuDX displays a pass or refer message, then stores the data to be reviewed later or printed for the patient's record. AuDX comes complete in its own carrying case. Inside the case, you will find the AuDX unit with rechargeable battery, the ear probe and cable, a battery charger with cord, a user and service manual, and a sampler pack of ear tips. The ear tips are available in a variety of sizes. Generally, the clear flanged ear tips or the pink-tinged preemie tips fit most newborn ears, while older infants may require larger tips. The smaller, beige foam tips fit most children between 2 and 10 years of age, although some adults with small ear canals may require this tip size as well. The larger foam tips are for adolescents and adults. Each tip is designed for single patient use only and must be discarded after the test. Before you start testing, we recommend you charge the AuDX, preferably overnight, and review the following information and procedures. Fully assemble the AuDX before the patient arrives to save time during testing. Make sure the probe nozzle is securely attached to the probe body and clear of any debris. Then plug the probe cable into the AuDX unit. Hearing screening is best performed on an individual who is comfortable and quiet. You do not need a soundproof environment to perform the screening, but it is recommended that you keep sound levels to a minimum. Of course, some testing environments, such as neonatal intensive care units, are inherently noisy. In such environments, refer rates may be higher due to the elevated level of background noise. For infants and newborns, hearing screening is most successful when the baby is sleeping. Screening shortly after feeding and diapering is ideal. A pacifier may be used to calm the baby, although vigorous sucking can interfere with the test. Also, it is helpful to swaddle the infant in a blanket to restrict movement that could dislodge the ear probe. Once the probe is in the child's ear, the OAE screening can be completed in a matter of seconds, so it is possible to obtain reliable screening results even if the child cooperates only for a few seconds. To begin a test, select the appropriate size disposable ear tip. Choose a tip that is approximately the size of the ear canal or a little larger. A good, tight fit will help reduce interference from background noise in the room. The clear, flanged, and pink smooth ear tips are for newborns. The blue tips are for older infants, and the foam tips are for adolescents and adults. In this case, since we will be testing an infant, we'll choose Biologic's patented tree tip. Slide the ear tip onto the probe nozzle until you meet with resistance. Then place your fingernails behind the thickened ring around the base of the tip and slide the tip on until it is all the way on the nozzle. When you look at the probe with the ear tip attached, you should see that the tip covers the nozzle completely. There should be no visible gap at the base of the nozzle. Next, grasp the earlobe, gently pulling out and forward. While holding the ear in this open position, slip the probe tip into the ear canal with a slight twisting motion and release the earlobe. The ear canal will close around the tip and you will be ready to start the test. Holding the probe in place is not recommended since slight hand movements can generate noise and affect the test outcome. Remember, the tips are designed for single patient use only and must be discarded after testing. To remove the silicone ear tip, hold the probe body with your fingers on top of the nozzle clips. With the other hand, place your fingernails at the base of the ear tip and slide it off the nozzle. For testing an older child or adult, use the beige foam ear tips. Select an ear tip that is a little larger than the patient's ear canal. Place the clear tube slightly onto the nozzle of the probe body. Then, using your fingertip, continue pushing on the top of the foam until the clear tube completely covers the entire nozzle with no gap at the base. Do not pinch the foam while attaching the ear tip, as this will make it harder to install the tip properly. Clip the cable to the patient's shirt to keep the weight of the cable from pulling on the ear probe. Compress the foam ear tip by pressing around its outer edge until it is approximately 1/2 its normal diameter. Next, grab the outer ear above the earlobe and gently pull up and backwards. Insert the compressed ear tip into the ear canal and release the ear. The tip will expand in the ear canal and you can start the test. Let the patient know that they will hear sounds and that they should remain as quiet as possible throughout the test with no talking and limited movement. Remember, the tips are designed for single patient use and must be discarded after the test. To remove foam tips from the nozzle, hold the probe body with your fingers on top of the nozzle clips. Then, with the other hand, place your fingernails behind the clear tube at the base of the nozzle and slide the tube toward the end. Do not pull on the foam. This will cause suction in the tube around grooves in the nozzle and will actually impede the removal. Begin the test by pressing the On button. When the screen appears displaying the AuDX software version, press the DX button. A message will appear reminding you to record the test log number in order to track the results for each patient. Press DX again to display the screen for identifying the test ear. Indicate if it is a right or left ear test by using the up or down arrow buttons. Simply press the DX button again to begin the test. AuDX will check the probe fit before performing the test. If there's a problem, AuDX will display an error message. In most cases, the probe in ear, refit, and retry error can be resolved by reinserting the probe in the patient's ear. Environmental or patient noise are the most likely causes of the high number artifacts error message. If it occurs, move to a quieter environment or try to quiet the patient and reinsert the tip to achieve a tighter fit. An occluded probe error is caused by debris clogging one of the grooves in the probe nozzle and can be resolved by cleaning the probe. For additional help, refer to the troubleshooting procedures provided with the unit. After resolving any problems, press DX to continue the test. During the test, you will see information about the test's progress. The numbers or text shown will depend on the type of OAE test, distortion product, or transient that you are performing. When the test is complete, AuDX will display a message indicating pass or refer. If you want to review the patient's results after the test, press the DX button. To move through the results, press the up or down buttons as needed. When you are finished and want to test the other ear, press the Restart button to return to the beginning of the program. Now, let's quickly review. Press the On button, then press DX to enter the program. Press DX to go to the ear selection screen. Select the ear you want to test, then press DX again. After checking the probe fit and calibrating, AuDX will perform the test and display a pass or refer message. Press DX again to display details of the results. It's that simple. There is no off switch for AuDX. After 3 minutes of inactivity, the unit will automatically shut off. This feature helps conserve the battery. If you have the AuDX label printer as part of your system, you can print out the results on a self-adhesive label to include in the patient's record. Make sure that the printer is fully assembled and that the printer's power supply is plugged into a wall outlet. Attach the red connector on the gray printer cable into the red-rimmed socket on the left side of the AuDX unit. Always remember to be gentle with the cables and connectors. Metal pins inside the connectors can be bent or broken if they are twisted or misaligned as they are attached. Verify that the printer has power, then press the On button on the AuDX. Press the DX button to reach the AuDX menu options. When the Perform OAE message is visible, press the down arrow button until the Print Test Results message appears. Press the DX button to select. Press the up or down arrow button to scroll through the list of all tests stored in memory. When the test number is visible that you wish to print, press the DX button to select. Repeat this procedure for each of the tests you wish to print. If you want to print all previously unprinted data stored in memory, press the DX button when the Print All Unprinted Data message is visible. Proper maintenance of the AuDX system will make testing more efficient and extend the life of the equipment. Inspect the probe nozzle for debris in any of the 3 grooves. If debris is present, clean the grooves with a tissue or gauze pad. An alcohol wipe can also be used. Be sure to clean the grooves from the base to the tip to avoid allowing any liquid or debris to move into the closed channels at the base of the grooves. These closed channels cannot be cleaned, and the nozzle will need to be replaced if they become clogged. The probe nozzle should only be removed to troubleshoot data collection problems. The clips that hold the nozzle on the probe body will become less effective after the nozzle has been detached a few times. When this occurs, the nozzle will have to be replaced. If the nozzle must be removed, locate the 2 small clips that secure it to the probe body. The top clip has a ridge of additional plastic on its surface. The bottom clip is flat and smooth to the touch. Use your fingernail to lift up on the end of the smooth, flat clip to unlock it. Next, use your fingernail to lift up on the clip with the ridge and unlock it. After both clips are unlocked, gently pull the nozzle off of the probe body. Never insert anything into the openings in the probe body that appear when the nozzle is removed, as this could damage sensitive components. To install a new probe nozzle onto the probe body, make sure that the nozzle is oriented so that the shape of the cavity matches the shape of the probe body. Align the clips on the nozzle with the corresponding slots in the probe body, and then slide the nozzle clips onto the slots until they lock in place. The nozzle component should now be securely attached to the probe body. Store the unit in the handy carrying case with a clean tip attached to the probe nozzle to help assure a long life for the equipment. The AuDX system makes hearing screening using otoacoustic emissions fast, simple, and portable. If you have any further questions about AuDX, please call your AuDX dealer or contact AuDX customer support at 1-888-4-AuDX.